To understand how anemia occurs, we need to know the life cycle of the red blood cell. Red blood cells are formed in the bone marrow. Proper formation requires specific conditions to be fulfilled. Firstly, it requires a healthy bone marrow. If the bone marrow is unhealthy due to conditions like leukemia, myelodysplastic syndromes, chemotherapy, and radiation, it will produce abnormal blood cells. This condition is called dysplastic anemia. Toxins, viruses, certain medications, and autoimmune diseases can stop the bone marrow from producing enough blood cells. We call this aplastic anemia. This can affect all blood cell types, not just red blood cells, resulting in a condition called pancytopenia. The bone marrow requires signals from certain chemicals, like erythropoietin and cytokines, to stimulate red blood cell production. These chemicals are adversely affected by chronic conditions like kidney disease, cancer, or autoimmune diseases. This causes reduced red blood cells, leading to a condition called anemia of chronic disease. To produce normal red blood cells, the bone marrow requires raw materials like proteins, iron, vitamin B12, and folic acid. Malnutrition and diseases affecting nutrient absorption, like celiac disease and inflammatory bowel disease, can lead to iron or vitamin deficiency, anemia, or a combination of both. If our genes are faulty, none of these matter. Genetic disorders like sickle cell anemia and thalassaemia will produce both abnormal red blood cells and hemoglobin, compromising oxygen-carrying capacity with resultant anemia. Red blood cells start out as reticulocytes. They have a lifespan of 120 days. At the end of their lifespan, they are broken down into their components in the liver and spleen. Premature destruction of red blood cells occurs in haemolytic anemia, caused by a variety of conditions like autoimmune disease, deficiency of G6PD enzyme, malaria, and certain medications. Blood loss is a frequent cause of iron deficiency anemia, often resulting from heavy menstrual bleeding, gastrointestinal bleeding, or bleeding from the urinary tract.